Hi guys, thanks for having me. Thanks to Maya for the introduction and for your wonderful marketing of this because I always forget. So I'll quickly introduce myself and the project. Hi, my name's Elinor. I'm a first year PhD student. I'm funded by the UKRI ESRC SCDTP, and I'm doing my PhD at the University of Portsmouth in the Department of Psychology under the supervision of Amine, Stephen, and Beatrice. So my research generally focuses on autistic students' experiences of university or higher education in general. And today my research, well, my talk is based on research that I did for my master's degree at the University of Southampton under the supervision of my current PhD supervisors. So as you can see, it was involving autistic university students and disability support staff. And before we get started properly, I'll just quickly say that I'm going to be using mostly identity first language because that was what most of my participants indicated. If there were person first preferences, I would be respecting that, but I don't believe there were. So yeah, I'll just move on. So a little bit of background on the topic for those of us who aren't familiar. So we are generally seeing an increasing number of diagnosed autistic students in higher education or those who are disclosing at least. And that's a general increasing trend kind of in different countries, although obviously specific numbers will depend on where you are in the world. And we know that there are lots of different countries that have got laws about supporting autistic students. So for us here in the UK, that would be the Equality Act. And that just kind of says that universities and education providers need to have reasonable adjustments in place to support autistic students. But despite the presence of legislation in different countries, we know that from recent research, support can be really varied between institutions, and that there are many institutions that are not adequately supporting their autistic students. And this is seen in lots of students who still report non-inclusive university cultures, as well as a lack of support overall. And that's obviously not a good thing. So there is this kind of gap between what should be done, what is expected, and what is in the law versus what is actually being done. And so we need a better understanding of where exactly the gaps are. So where there might be problems and where we could better address them, so that not in a blaming people kind of way, but just understanding where to start working. Yeah. So that kind of takes me to the research questions that I was looking at. So basically, I was asking autistic students what are their experiences of receiving support at university. And in the parallel perspective, I asked staff members what are their experiences of providing or coordinating support for the students. And then I also asked what kinds of support they got in what areas of higher education. So, whether they requested supports, whether they rejected supports, whether it was like what was the process of getting them? Were they good? Were they useful? Why were they not useful? And so on. And then finally, I also asked how higher education can improve, basically, what students and staff thought needed to be done in order for universities to be properly supporting students as they are legally obligated to. Yeah, so this was a UK-only study. I did most of my recruitment online from social media, from networks such as this one, and from databases of participants like the Cambridge Autism Research Center database is a really big one. I had interviews with students and staff is kind of a vague term. I was basically looking with anyone who was in a supporting role at a university in the UK. So that could have been a specialist mentor, it could have been a tutor, it could have been a disability advisor, and so on. And so I did interviews over Zoom, or by email exchange, where we would send interview questions and answers back and forth until either I didn't have any more questions or the participant didn't have any more follow-up elaborations. And then my participants had the option to do a lucky draw for Amazon vouchers at the end, although not everybody wanted to do that. Yeah, so this is a table of participant characteristics. On the left column, you'll see the characteristics. The middle column is data from the students, of which I had 10, and then the rightmost column is data from staff, of which I had 8. And we'll go through them kind of row by row so I can explain to you what all these numbers mean. So first row is age. That's quite self-explanatory. So students were aged between 19 to 63. Most of them were your quote unquote typical age of like kind of early 20s. That's where the average is like 26. Staff members were 28 to 56 years old with an average of just under 40. And then from the next row, you'll see that most of my students identified as male and most of the staff, identified as female. And all the participants were white except for one Chinese student and one staff member who identified as mixed Asian and white. And then the next row is headed year. So basically I asked students, what year are you in? They were mostly undergraduates, mostly second years. And then I asked staff members, how many years have you been in a role that involves supporting autistic students? And I had quite a wide range there from 1 to 22 years. And then the next row is titled number. So this question I asked students, how many staff members do you think you've contacted regarding support at uni? And the answers were between like 1 to 2, all the way up to 9 or 10. One participant actually told me that there were so many they had lost count because of the high turnover rate. And then I asked a parallel question to staff, which was, how many students have you supported in your role, at the university, or across the years, really? And so the lower range was from less than 20, and that was actually the person who had been working in this kind of supporting role the least number of years. The upper bounds were like hundreds because, big universities, high student staff ratios, and they'd been working there a long time. And the final row is just the mode of participation. So you'll see that students were kind of evenly split, whereas staff preferred to participate over video calls on Zoom. As for the interview questions themselves, I looked at literature, I looked at different aspects of higher education that we talk about, so transition, academic supports, and so on. And I wrote questions for students, and then I wrote a parallel question schedule for staff. And so quite broadly, we discussed different types of support. So I would ask students, what are some adjustments you've received? And then the parallel question is, I would ask staff, what are some supports available to students at the university? And then I also asked about experiences of getting the support. So I asked students, how did you get the support? And I asked staff members, basically, how do students receive supports? What do they have to do in order to get what they need? And then there were also general questions about, like, for example, the transition experiences, other general challenges, interacting with staff and students, and then, of course, like improvements for higher education. How can universities do better to support autistic students? Yeah. And then I performed what I'm calling at least reflexive thematic analysis. So thematic analysis referring to patterns, on looking for patterns and common ideas in the data. And that's a qualitative analytic method. And so reflexive is the part where we kind of account for the ways that I, as the researcher, approach and interact with the data. So that involves me reflecting on my understanding of higher education, of autism, of higher education in the UK, and so on, and how that affects the way that I interpret the participants' responses. And we'll come back to how this impacts the data when we talk about positionality later. So I transcribed all the video interviews. I anonymized everything, including universities, the regions in the UK, where people were from, and so on. And then I coded the responses, so assigning labels to different chunks of text. And then I looked at the themes, which is the common ideas. And this process resulted in 3 themes and 4 sub-themes, and we'll go through them in turn, and I'll have quotes from my participants on the screen as well. So the first theme is preparing for university can be a lot of work. So this theme describes how students and staff told me about the different ways that they prepare for the new academic year. And some students will start preparing like way early before they finish the A-levels while they're still in colleges. Some of them only start in the summer right before the university term starts. And it can involve, various different things. So for example, this student said, before I started choosing my universities, I would look up like their disability services pages, and at the open days, I would go seek them out and go to talk to them, and they would explain what they do and what I have to do. And so this was quite a proactive participant. They were talking about, looking online for different things that the university could offer them and what they need to do to get the support that they want. a lot of participants also talk about a specific transition event. So not just an open day, but a specific transition event for autistic students or for disabled students generally. And it's often organized by the disability staff, and the students will go with their parents or with their carers. And it's an opportunity to connect with support teams and so on. And so the staff member is describing what happens at the event. They said, we talk, I guess, in a bit more detail about disabled students allowance, the supports available from our team, supports available in the university, and things that students can do to start planning and preparing. So now why I said that it can be a lot of work, that's because a lot of the things that the students have to do a lot of things to prepare, to the point that one of the staff members actually told me that the university has a new role where they have a dedicated transition officer that's just to help students navigate all the different things that need to be done in order to prepare for university, because they were saying that like it was getting confusing, and it could result in students getting quite stuck there, and they were losing students as a result of that process not being managed well. So having that transition officer helps to ensure that entering university is a bit smoother for students who didn't quite cope well with all the stuff that they had to do to prepare. So that brings me to my second theme: getting support is not always easy, kind of like how I just described. So firstly, there were different types of supports that were accessed, lots of stuff that you might expect. So there were lots of mentions of academic support, like getting extensions, like getting captions on lectures, getting lectures recorded, and so on. Financial support, so the Disabled Students Allowance, which if you haven't heard of is like the public fund for students to access, and it funds things like mentoring. Specialist mentoring is a really big one. Travel allowance for taxis if students can't take public transport to campus. Students also get like housing support, so if they've got a specific accommodation type that they need. They also talked about social groups at uni, and that's kind of like more casual, not necessarily very formal groups. And usually getting the support involved meeting disability staff, disability advisors. It involves getting an assessment in order to use the DSA. Sometimes they need an assessment if they don't have a formal diagnosis of autism as well. And that goes through the NHS. And they also make a support plan that tells the university staff members what adjustments the particular student has. And so it's quite a complicated process, and that will come back to a systemic problem that I'll touch on in a bit. But first, we'll talk about individual barriers to getting support at uni. So this is kind of like challenges relating to the individual person. So quite commonly, mental health came up. There was also self-advocacy challenges. So one student said, I felt like too awkward to say, yeah, I do need that. So I just went and hoped for the best. And there were other mentions of how they weren't feeling. Some people didn't feel comfortable asking for help, or they knew that they needed help, but they just couldn't bring themselves to, and that kind of caused them to not get help in a timely fashion. And then another sort of like individual challenge relates more to the autistic experience of university. And this is not to say like that I'm in a way that blames autistic students, but it's more of the difference between an autistic versus a non-autistic student's experience. And it relates to a sort of hidden curriculum that quite a few of my participants mentioned that non-autistic students seem to just get, but autistic students didn't always, it didn't always click for them. So this student said, you can't ask because this is higher ed and people will despise you for being such a fool, and not knowing what to them is blindingly obvious. So staff members have said that this sort of hidden curriculum and autistic students not necessarily knowing what it is changed their approach in the way that they work with people. And now they don't assume that somebody knows what to expect from a particular situation, which can sound a bit patronizing, but the staff members explained that the way that they've adjusted their support, it means that they help to set expectations for people who haven't been in a particular situation before. So just for example, they were talking about self-directed learning. And they had students who were working, like 90 hours a week and just like burning out because they were so exhausted from being really, really conscientious, and it was just too much. And then there were also students who were only working when they were in class and not engaging with the learning material before or after, because that's what they've been used to in school and they hadn't been told otherwise. Whereas, non-autistic students, it might be a bit easier, or that might be more natural for them to adjust for self-directed learning. And so it's these these ideas of unspoken rules of how university works and how it might be blindingly obvious to non-autistic students, but autistic students might not find that so, it might not come so naturally for them. Obviously, everybody's different, but this was something that was reported by, I think, one student and quite a few staff members. So yes. And then, of course, we look at external barriers. So one of them is that university departments don't often communicate with each other. So the student said, I have often found that, for example, my department has not been aware of my disability or the adjustments they should be implementing because it has not been passed on from disability services. And sometimes, even if there is communication between the disability department and, for example, lecturers or other support teams, sometimes supports just don't get implemented. So this staff member actually said, you might have the perfect set of adjustments for you, but in year 2, it's a different set of lecturers and half of them don't want to do it. And sometimes that's just the reality of the situation, very unfortunately for students. And then another type of external barrier is a more systemic one. So one example is under-resourced disability services, which is quite common. So the student said there are currently not enough advisors to cover all disabled students, and this results in extremely long delays in getting support plans, failure to provide reasonable adjustments early enough, and students performing well below their potential as a result. And sort of in relation to that, another problem is within the public services. So like I said, sometimes students who don't have formal assessments, formal diagnosis of autism, if they need to get that in order to access support, they would have to go through the NHS to get that. And that waiting list can be 2 to 3 years long, depending on where you are and what services are available locally. The DSA process itself has got many steps. It's quite complicated. And so some universities have adopted a slightly more flexible approach to support in response to that, because they know the students have been caught up in like the paperwork and such. So this staff member said, whilst they, as in students, were waiting for a diagnosis, if we thought it was reasonable for them to have funded support, we will make a case and the university would pay for it. I think it would be kind of impossible for us to not support people that are on the waiting list. It would feel very discriminatory. So this is obviously only possible if the university has additional funds or flexible funds that could be diverted to support disabled students this way. And the final theme is talking about improving university. So the first sub-theme talks about making university more accessible. So generally making it easier to access support by reducing the burden on the student, by streamlining application processes, being more flexible on what is needed for students to get help. So the student said universities should stop requiring medical evidence first. If you want medical evidence, give the support anyway until the student gives the evidence. Students shouldn't have to provide proof that they need help. And so like the previous quote that the staff member was saying about the university being able to fund support, sometimes that's possible if the university can be more flexible about the evidence requirements. Not all of them are able to do that or are doing that. But kind of relating to that, a lot of staff also alluded to or directly talked about universal design, which is the idea of like embedding accessibility at the forefront of everything so that you don't need a diagnosis to receive support from people. And so lots of examples were given, like enabling captions by default on all lectures, recording all the lectures by default and sharing them with all the students, having multiple assessment methods as a default option for all the students to access. And one of the biggest merits that was mentioned was that this also, helps not just autistic students and not just students with a diagnosis or whatever, but it just benefits the entire student body really, not just ones with documented support needs. And the final sub-theme is to improve support delivery. So specifically, more resources for the disability service. Some students have talked about, more funding generally, more advisors, faster turnaround times for support plans, more reviewing of support. So looking whether supports and adjustments are actually useful for students. And of course, more training for staff, for student-facing staff. And so this student has said their university tutors just don't know anything about autism until these institutions actually understand properly about autism. No, it isn't really meant for girls. They were all wasting our time asking for support and help from studying. So neurodiversity training was quite commonly mentioned by a lot of people. And that kind of ties into the limitations of this study. So first of all, I said that we had students and staff participate in the study to get two sides of the support receiver, support provider perspective, but that's still just two of many perspectives. And in reality, there are lots of other people who are involved in the support of autistic university students, like counselors, teaching staff, and so on. And it would be good to get a greater diversity of perspectives in the future. And it would also have been better to have gotten people from a wider spread of universities. I won't say where people were from for confidentiality reasons, but I had little pockets of participants kind of across the UK, and generally just like a wider spread, more universities, more different types of environments would have been like just richer in general. And then finally, in relation to positionality, and this ties into what I said about the data analysis earlier. So I'm a researcher from Singapore. I moved to the UK to do this master's research and to do my PhD. And even though I have done research in this exact topic in Singapore, the systems are really different, the culture is really different. And of course, I had read up on the UK system and what support at university is like here, but there's still quite a few unknown unknowns. So just for example, I thought that specialist mentoring was like a casual, informal mentor who was a staff member at the university. And it was only after talking to one of the participants in greater detail and through deep dive much later into the internet that I understood it's a full job scope. It's a specialist role that's fully trained. There's training and local organizations and so on. And so obviously, if I went back now and I talked to earlier participants, then I would have the benefit of hindsight and I'd probably be able to ask more insightful questions. And so, my interviewing got, better and richer over time, but it also just means that I'm slightly better prepared for future research, but it's something that I have to acknowledge for the current one. It would also be better if there had been more autistic input in the study, because this was for my master's and the time frame was quite short. It was limited to having input from my second supervisor, who is openly autistic. And although obviously he was very insightful and helpful, the study conceptualization and initial decisions like the questions or how to do the interview, these were my decisions. And even though I made them, with consideration of guidelines for accessible research and so on, they were still my own input. And in the future, I would like to be more collaborative with different community partners. And so I'm working towards that for my own PhD research. And so finally, the implications of this for different stakeholders that I've listed here. So unfortunately for students, because of the different challenges that are presented, we know that students need to be prepared and be prepared early because things can take quite a lot of time. And often also they need to practice self-advocating because unfortunately the reality is that there are often people who may not understand what autism is, or they might have outdated ideas, or they won't know how to adapt their teaching to students' needs. And so students kind of need to be able to tell them exactly what they need. And teaching staff could be focusing more on accessibility and flexibility, so reducing the challenges that students face in accessing the learning material. And of course, as mentioned, undergoing neurodiversity training, because when you better understand students, then you can better support them. But universities and the disability services, I think, have the biggest load, burden, responsibility to invest in training, to reduce the burden on students so that they can focus more on being students than on trying to get support, and to allocate more resources to supporting disabled students. So, more staff members, more funding in general, more flexible supports, and so on. And for schools, we could consider teaching students self-advocacy from before they have to enter university, so that it's not so foreign for university students who might have to do that for the first time. And it also is helpful for when autistic people eventually have to enter, for autistic people who eventually enter the workforce and have to talk about access to work and accommodations in the workplace and so on. Now, having said this is all obviously very idealistic. It's limited by funding, policy, reality, and so on. And just for example, as I'm sure a lot of people are aware, the university staff across the UK are in the middle of strike action and negotiations over working conditions. And if we were to ask people to revisit their teaching syllabus, or to retroactively adapt a lot of their stuff, that would add to their already heavy workload. But I think it's important that we talk about, accessibility early on, so that in the future, at least, we have staff members who are creating materials, learning materials that are accessible from the get-go, instead of having to go back and retroactively think about accessibility. It should be something that's, at the front of our minds, as opposed to an afterthought. But of course, we also need to acknowledge that two really big things. One is that this is not in consideration of what the public health service systems are like. And if the NHS were a bit more efficient, if the DSA systems were different, that would make things probably slightly better. But that's a completely different challenge. And of course, also to acknowledge that this is just myself as a researcher's. Well, this is just researcher's perspective so far. It's really important for us to be working with community partners to make sure that research and practice are complementary and not in conflict, not contradictory, and of course that they're realistic and beneficial to the people who would be affected by the things that researchers recommend, which is why also that's something that I personally would like to be working with, and lots of researchers are also working on participatory approaches. So just kind of in line with what my research topic is about, if I were to collaborate with community partners, and it's what I'm striving to do, that could be people like teaching staff, it could be counselors, people, autistic students who drop out of school, family members, and so on. So there's lots of different people that we could be working with to make sure that research and practice are complementary. And like I said, I'm working towards that for my own PhD research, which I will be working on soon, hopefully. And I hope to be able to learn from a lot more experienced stakeholders in different positions in the near future. So yeah, that's mostly it. I want to say thanks to my participants, to everybody who helped to share my study information. I know that there were lots of people on here who probably saw my email or retweeted my advertisement, and I really appreciate that. And of course, to my supervisors for their support, like some who are here today, to the CDTP for funding me. And I have my email and my Twitter handle there. I can't remember why I put it there. But in case anybody had questions or wanted to contact me after the meeting, you can reach me at these places. Yeah, thank you.